So we're here today to talk about and demonstrate shockwave therapy. Now, shockwave therapy is a treatment that we have available at the clinic and that we use a fair bit when it's appropriate. For treatment of soft tissue conditions, tendinopathies, we tend to use it a fair bit for heel pain or plantar fasciitis. And essentially what it is we use a probe. So here's the probe. We use a probe to deliver high energy sound waves to the area where there's pain. And what that's thought to do is increase blood flow to the area, metabolic activity in the area, and start a healing process. So a lot of times with issues like tendinopathies and plantar fasciitis, that healing process just is really slow or doesn't happen at all. So in combination with a lot of other treatments that we use, the shockwave therapy is an option to get that healing process started. So Kevin's been nice enough to let me demonstrate on him today. So we're going to pretend that Kevin has plantar fasciitis or heel pain. And what we do with shockwave therapy is we find the area where there's the most pain, and that's where we'll be delivering the sound waves or the pulses. Now, let's for example say this is when I push through or apply pressure to this area of Kevin's heel. He says that's painful. What I would do is also push around that site to find the spot where it's the most painful. And let's say it ends up that this is the most painful site. What I would do is I would draw on that area there, and that's where I would be delivering the sound pulses. Sometimes it's more than one spot. If it is, then we just basically split the pulses between the number of areas where it's painful, but it tends to be one or at most two areas that are quite painful. Next thing you do, just apply a bit of ultrasound gel to the site where we'll be doing the shockwave therapy. Then we're ready to start. So again, that's the probe, and all I do is just put it on the skin in the area that I've marked, and then we start delivering the pulses. Are you ready?
Yes.
All right, here we go. All right, so as far as number of pulses, it's about 2,000 pulses at each site that it's painful. And then it depends on the number of sessions that we need to do in it. Or sometimes the pressure can be a little bit painful, and all we do is just decrease that pressure, and we make that pressure up over the sessions in which we do the shockwave therapy.